Erin, I already had people emailing me asking if it's going to be recorded because they were going to miss.
Always. Yep.
So it's a very good topic. And for those of you that might have joined and you don't know the topic, but I'm sure you do, it's hormones and cancer, managing medical induced menopause, which I had by nutrition recommendations. And we have two of our fantastic registered dietitians from the Unite for Her team here tonight to guide you through this very important topic. And I love this topic. I love listening in. I probably will have a little bit to add, remembering 20 years ago. But all that I wish I had you right there by my side, Erin, all those years ago when all this happened. Because,
Yeah,
it can really put you in a whirlwind. Yeah.
absolutely. And we hear that probably every day with our members that we connect with. Something related to medically induced menopause comes up in conversation. So we know how top of mind this is for our community. So we're really excited to start to dive in to some of the nutritional areas that are relative to this topic and provide some guidance, at least to get you started. But knowing that you always have our entire team available to you for more nuanced individual guidance and support.
You got it. Yep. And that team is available for you at any time, and as much as you need. And it's a phone call away, an email away. And so do not be afraid to use that. For those that are active passport users, it does not use any of your squares. So it's something that you can utilize, yeah, as you need it.
Wonderful.
I want to bring to everybody's attention, you all see us with our new shirts on. Eat more plants. Eat more plants. So we actually have Plantuary this whole week. So that's why we did this, because we are pushing forward our plant forward diet. And there is a whole incredible series that Aubrey has put together and led, and she'll be able to share a little bit more with you and how you can join and be a part of the pledge. So we're doing a
Absolutely.
little messaging on today's
Love that.
speaker series. I
Yeah.
want to
And we'll
thank
be
our
sharing the
sponsors.
link. Yeah.
Yeah, we'll share their link. Yep, I'm sure Aubrey will pop that in the chat for sure. I wanted to thank our sponsors. We can't do what we do without them for sure. So I'm going to share my screen, and we are so grateful. We have over 48 of these speaker series, Ask the Experts, virtual hangout, really unique and very top of mind topics like tonight. And we can't do it. We do without them. So our Unite for Her Connect is our new education platform. We rolled it all up into one incredible platform. And our presenting sponsors are Wes, Merck, and Daiichi Sankyo, with support from GSK, Lilly, Gilead, Pfizer, and Agendia. So a big shout out to them. And we appreciate all the support so we can bring you the best speakers, the most top of mind information, and the most valid and the most vetted as well.
Absolutely. And I'll jump right in because we still have more to bring you in our education events that we offer every month as part of our Unite for Her Connect digital education platform. So we have our Ask the Experts also taking place at the very end of the month. So if you have been following along on social media, you know that we are sharing lots of zero proof recipes and mocktails from some of our bartender friends for dry January. So we will be joined by Chief Breast Surgeon and Unite for Her advisor, Dr. Lucy De La Cruz, to answer all of your questions about alcohol and cancer. So we're certainly happy to take questions from our community, as with all of our Ask the Experts segments. We'll be streaming that live on Facebook, 1 p.m. Eastern time. So it'll be really nice to have some dialogue about the risks and the relationship between the two, as well as the new recommendations from the Surgeon General that came out earlier this year. So, but if you are looking for some zero proof recipes, we've got lots of delicious beverages on our blog and featured throughout our social media. As well as our Plantuary campaign. So I will let Aubrey share a little bit about that. Again, if you haven't signed the Plantuary pledge, please make sure you do so you can join us on how you can eat more plants all month long, but also all year long.
Yeah, love it. And I will just a little bit of housekeeping. I'm sure you all know by now, but we actually had over 170 registered for this event tonight. So it's very important that you have yourself on mute. You can use the chat for all of your questions. I will be monitoring the chat. I will be the wonderful host for Aubrey and Erin tonight. And then we'll be making sure that we go through there, and they may even be able to answer some of the questions right in the chat if they can, but I will get to your question for sure. We talked about recording the presentation, so you're all set there. And thank you for joining. We're really, really happy you made this time today. It's an important one.
Yeah.
Um, all right, shall we get started?
Absolutely. So I will give a little
Yeah.
bit of a topic intro as we bring Aubrey on the screen. She'll be kicking us off for tonight. So we will be reviewing together short and long-term side effects of medically induced menopause relative to nutrition. So we'll be bringing to you areas that we want you to be aware of, some tips for managing some of those side effects and symptoms. We'll also be touching on unique side effects of medically induced menopause in the younger cancer survivors and thrivers, so those under 40, and overall just offering considerations to optimize your health and well-being. So we know that there likely will be a lot of questions. We'll try to get through as many of them as we can, but we know that this is really just the start of a really important discussion, and we're so excited to bring this topic to you.
Yeah. Hi there,
Absolutely.
Aubrey. Thank you for joining us.
Of course, of course. And we have these conversations, each and every day, right, with our community. And so why not bring this more to the forefront, right, and dive more into the research? So I'm excited to get started and share it all with you today.
Yeah. So for those of you that don't know our staff, and I'm sure you do, Aubrey Red is our senior culinary dietitian, and of course, Erin Pellegrin is our senior director of culinary nutrition and education. And they're going to be leading you through, and I'm going to take the back seat. So I'm going to unspotlight myself. And then Aubrey, are you going to kick it off?
I am. I am. So, first and foremost, as you may have heard from Sue and Erin, this Hormone and Cancer Managing Medically Induced Menopause Her Speaker series is a part of our Plantuary series. So, I am confident that many of you are familiar with Plantuary. However, if you are not, it is our month-long period throughout the month of January to help encourage you to eat more plants. So, we know that plant foods can be really healthy. We may see a little bit of that today in our presentation as well. And we talk a lot about New Year's resolutions this time of year, but really all we want to help encourage you to do is eat a little bit more plants each and every day. And so with that, we have new recipes coming every single week, as well as lots of live events. Last week, we hosted a virtual hangout with our entire nutrition team. And as Erin mentioned, we have that dry January tie-in as well. So be sure to check out our Plantuary page. I did share in the chat, you can sign our Plantuary pledge, which is just you letting us know how you plan to participate in Plantuary. At the end of the month, we will be doing a sweepstakes raffle out of everybody who signed up for the pledge. So be sure to get your name in on that pledge. And I also put the link to these wonderful t-shirts, our Eat More Plants shirts, if you would be interested in getting one as well. So that's just a little bit on Plantuary to get us started. But really, we're going to dive into the meat and potatoes today. So I'm going to go ahead and share my screen. And so to begin, before we even jump in, I just want to highlight that in a moment, we're going to do a little bit of kind of group participation style. So it'll involve you submitting words, whether it's via a phone, an iPad, your computer. So if you have a piece of technology available, great, pull that out. We can also use the chat, and Erin will help along to kind of support with getting some of those into. We're going to make a beautiful word cloud together. So our topic on managing medically induced menopause really is brought because of the population that we're working with each and every day. So we know that because of the treatments that we're going through, we may be experiencing medically induced menopause or just traditional menopause, right? I think it's such an important topic to highlight and to speak on, as well as to learn about maybe some of the myths and misconceptions and diving into really some of the things we can combat and control when it comes to some of these symptoms and side effects. But I wanted to start by just sharing what do I mean when I say medically induced menopause? Because I feel like that's kind of a big term. And so, really, this is menopause that's brought on by a treatment or an intervention to stop ovarian function. This could be surgery, right? Like an oophorectomy. It could be chemotherapy. It could be radiation, perhaps medication for ovarian suppression. And now Unite for Her works with the breast and ovarian community, but I think it's important to highlight that it's not just that community that may experience medically induced menopause. We're thinking breast and ovarian cancers, but also cervical, endometrial, uterine, fallopian tube, colorectal, and peritoneal cancers may all result in medically induced menopause. And because it's different from traditional menopause, which is a bit more gradual and long-term of a process, this abrupt and sudden loss of hormones typically results in more intense symptoms. So we may have more significant side effects that have a more serious onset, right? They come on quickly and they're very different from what we're typically experiencing day to day. Now, what I was saying as our little bit of an interactive component, I want you to think, what are some common symptoms of menopause? So it could be, what are some common symptoms of menopause you experienced? It could be things you've heard about from a friend, from a loved one. It could be things you're knowledgeable of. So just think on that for just a moment. And I'm going to go ahead, I'm going to pull up our word cloud that we're going to use. So what you can do is you can actually take your phone, tablet, what have you, and scan this QR code in the top left. When you scan the QR code, so just take out your camera, tap the QR code, it'll bring up the link. You can input a word or multiple words for what are some common symptoms of menopause. So I see them starting to pop in now, which is great. So you can also put them in the chat and Erin can help and put them into our word cloud as well. But I love this format because it'll show us what are maybe some of the more common symptoms versus what are still symptoms, but maybe a little bit in less frequency, right? So we see hot flashes as the big, bold #1 thus far. We've got weight gain, dry skin, night sweats, and joint pain are starting to pick up in intensity. Joint pain a lot, thinning hair, extra belly fat, facial hair, dry eyes, bloating, mood swings, insomnia, irritability, confusion, more hair loss, bags under the eyes, joint pain, hot all the time. I'm trying to think. I think I got all of them. Hot, sagging skin, poor sleep, eczema, loss of libido, irritability, mood. This is great. Thank you guys all for inputting your thoughts into the word cloud. And so with that, you can see maybe what are some of the more common symptoms that we see associated with menopause. The big being here, weight gain, hot flashes, dry skin, vaginal dryness, joint pain. And then in a little bit lower, loss of libido, mood swings, thinning hair, dry eyes, insomnia, facial hair. There are so many symptoms, right, of menopause because estrogen impacts so many of our body's systems. And so I wanted to do this to highlight to you that you're not alone, right, in these symptoms you're experiencing. Even if you have one of these smaller gray symptoms, right, I can guarantee you that someone else input that as well. So we're all going through this journey together and we're all going to learn together today. All right, so we saw what in this group our common symptoms are that we think for menopause and what we are experiencing. So I wanted to highlight what we plan to touch on today. And these are some of the most common symptoms that Erin and I are hearing most often when we're having conversations with our members. And these are things we can certainly impact from a nutrition and a wellness perspective. And so I want to touch on a little bit about each today. So for each of our symptoms, I do want to highlight 3 main nutrition considerations, as well as one common myth that I think maybe some of us may believe or historically thought, or even just hear buzz about, right, around certain symptoms. So first and foremost, I feel like this is perfect timing because it was the largest on our word cloud. I have weight gain. And this, I think, is something that Erin can probably attest to as well. We hear this all of the time from our members, is this weight gain. During the menopause transition, fat mass does increase more rapidly. That is a fact. But a common myth I want to highlight is that weight gain during menopause is inevitable and cannot be controlled. I think in this aspect, it's important to highlight and note that what has worked before, perhaps for you, a friend, a loved one, for weight loss or weight maintenance, might not look exactly like what will work now in the present, right? We may have to shift. We may have to refocus on our goals and what we're working towards. Some recent population-based nutrition and menopause studies, one done in Brazil, showed actually that it was really sedentariness over menopause that had a twofold impact on weight gain over menopause itself, which, of course, acknowledging that sometimes these treatments may lead to us being a bit more sedentary, right? We may have more fatigue, we may have more discomfort. But the thought being that long term, things like exercise and movement, which we'll get to in a little bit, as well as a calorie deficit or mindfulness around intake and quality of nutrients, is important for reductions in both metabolic and cardiovascular risk. So when we talk about our calories and what we're consuming, I want to talk about how a lot of times it's really important to think about quality over quantity explicitly. So I have this conversation all the time, right? You could have an apple that's 100 calories, right? Or you could have a bag of diet sugar-free cookies that are 100 calories. We're going to obtain vastly more nutrients, right? Vitamins, minerals, fiber, antioxidants from something like an apple, a whole plant food. So when I say quality over quantity, that's what I mean. I don't want anybody to feel bogged down by the numbers as far as like calories in, calories out in specificity. Now, quality-wise, it's important to prioritize lean protein intake. So this is things like our plant proteins, beans, lentils, nuts, seeds, whole grains, but also our lean animal proteins, low or non-fat dairy, chicken, turkey, fish, seafood, eggs. Ideally, we are aiming to get 1 to 1.2 grams per kilogram of body weight of protein per day. Now, I know you're probably thinking, Aubrey, I have no idea what I weigh in kilograms. Let me tell you, take your weight in pounds, divide that number by 2.2, and that is your weight in kilograms. So ultimately what that looks like is about 20% of your energy intake. And so I just ran some numbers beforehand. So let's say for about a 150-pound person, that's about 70 to 80 grams of protein per day, just to give you a bit of a reference range. I think sometimes we think protein, it has to be tons and tons. And of course, protein, as we see, is an important fundamental block in supporting our weight as far as satiety and lean muscle mass is concerned. However, I think it is important still, again, to consider the quality of what we're eating, right? We don't just need to have only protein. We need things like healthy carbohydrates, rich in fiber as well.
There was a question in the chat, though. I will just, while you're on a little pause there, and I know Erin said, she identified the lower belly area, but Alicia was wondering, like, why is it that the weight always seems to be in the lower belly area?
Yeah, it is really that menopausal transition where our fat mass is increasing more rapidly. It tends to centralize. We call it central adiposity. It tends to really localize to that central belly area. It's just kind of those changes in our hormones that impact the fat deposits, but also where they are depositing as well. And that's why we do see it in that lower kind of central belly area.
Yeah. And then will you just do that calculation again? How much protein do you need for your recommended weight? We just sent
Sure
another.
can. Yes. So it is 1 to 1.2 grams per kilogram of body weight per day. Awesome. All right, well, I will just move right into our next bullet point. And if anybody has a question, of course, yeah, pop in, raise your hand, use the chat. We will have time at the end too for questions as well. But circling off of protein's important, however, we do need other nutrients as well. So increasing our fiber intake through healthy carbohydrates, things that are rich in fiber like whole grains, fruits, vegetables, beans, lentils. Again, a lot of our plant foods, we're thinking plantuary. Those are going to help improve satiety. So when we eat fibrous foods, they help our bellies to feel more full, which can help with things like portion control, right? When we're thinking about calories and things of that nature, when we're having more fiber, it's going to help us feel fuller for longer, give us more long-lasting energy, but also help to support a healthy gut microbiome so that we're really truly digesting all of our food and absorbing the nutrients that we need, as well as moderating our hunger hormones, which begin in our gut. They're called ghrelin and leptin. So thinking about that, ideally for women, we want to get over 25 grams of fiber per day. Now, let me pump the brakes there and say we don't necessarily want to go from 5 grams to 25 grams of fiber per day. I get the question a lot about things like beans causing gas or bloating, feelings. And I will say that gas and bloating is a pretty normal response to eating more fiber. It's actually just the fiber breaking down in your stomach that releases that gas. Now, we don't want to feel uncomfortable. So what I would recommend is add a little bit of fiber, a little bit at a time, and your body will start to learn how to digest that fiber in more of its entirety. Last but not least on our weight gain list is limiting added and refined sugars. So in that calorie discussion, limiting added and refined sugars, I oftentimes call added and refined sugars more calorie or energy dense foods. They're not necessarily always the most nutrient dense, meaning they don't usually have a lot of protein or a lot of fiber or vitamins or minerals. Now, the recommendation is to stay under 24 grams of added sugar per day. And this is added sugar. So not necessarily the sugar in our fruit, for example, but perhaps the sugar in our sweetened beverages, for example. Now, it isn't that we want to get to 24 grams every single day, and try to achieve that number. We just want to try to stay as minimally as possible. With that thought, I think keep things that you enjoy in your life. I know Erin and I have had this conversation before, right? We have coffee with coffee creamer in the morning because that brings us joy to have that little bit of sweetness with our coffee in the morning. And then I think choosing where that sugar, if you're having it in your diet, feels important and authentic to you, right? Is it like a little chocolate after dinner? Is it your coffee creamer or something else? Or maybe it's the 1 or 2 grams that are in the loaf of bread you buy that are inevitable, that you can't get away from. So thinking about as minimal as possible, acknowledging that there's some space for some sugar in the day, right? It may occur. Now, moving towards hot flashes, I want to start with our first bullet point says to incorporate phytoestrogens like soy. So I know that we're probably going to get some questions on phytoestrogens and soy. So soy contains phytoestrogens, plant estrogens, which are plant compounds that have similar chemical structure to estrogen, but are significantly weaker than human estrogen. They have estrogen-like properties, but they also have antioxidant and anti-inflammatory properties. And while it is true that phytoestrogens will bind to the body's estrogen receptors, they don't always mimic estrogen. This is because there are 2 different types of estrogen receptors in the body. There's alpha and beta. And I think that some concern and misinformation around this topic highlights historical research that was done in rodent studies that showed increase in breast cancer in rodents with this phytoestrogen consumption. Now, it's important to note that since then, we've found that rodents and humans metabolize these phytoestrogens, these isoflavones, very differently. We actually know that they do not affect breast tissue density or cell proliferation, which is that rapid increase in cells that we see in cancer. Typically in hormonal breast cancer, Also, the concern is estrogen plus progestin rather than estrogen alone, which worsens breast cancer risk. So soy has no progestin activity. So I just wanted to highlight the multiple reasons why we talk about soy and we find soy safe. And now thinking about these positive benefits, there's some indication that at least among women with breast cancer, soy actually acts as an ER antagonist, meaning it's working against estrogen. A meta-analysis including multiple studies found that soy food intake after diagnosis was associated with reduced mortality. And now, thinking about hot flashes, right? We're circling back to the root of the point. I want to highlight this model I have on the right. So this was a study done in 2021, a 12-week study where folks were consuming a low-fat diet with half a cup of whole soybeans a day. So think adding half a cup of edamame to your salad every single day. Nearly 60% of women became totally free of moderate to severe hot flashes, and overall hot flashes, even mild ones, decreased by 79%. So you can see that diet group is green versus control red. That's people who weren't having the soy foods. They had a significant drop in their hot flashes. So we can use the consumption of whole soy foods and phytoestrogens to help us really support decreased hot flashes. It's important as well to stay hydrated to help with our body's natural cooling system. And then I wanted to highlight eating anti-inflammatory. So estrogen deficiency throughout menopause can lead to metabolic inflammation and dysbiosis that can lead to hot flashes. So trying to eat more plant foods, which are anti-inflammatory foods, as well as things like fish and seafood with omega-3 fatty acids, can really help to diminish or reduce hot flash frequency. Again, this is just a nutrition perspective. So there are, of course, many other factors that we can think of when it comes to some of these symptoms, but I just wanted to highlight that as well. A common myth, I think, is that spicy foods are the only dietary cause of hot flashes, but really it can be spicy foods, alcohol, caffeine. Some folks just may have different triggers than others. So sometimes I'll recommend keeping a log of your hot flashes, things you're eating. It can help you identify some of these symptoms as they pop up and if you're having dietary triggers.
Aubrey, I'm going to jump in real quick because as you said that in the chat, Allison was saying that sometimes she has hot flashes at night after she eats edamame. So she literally is hearing that trigger or seeing that trigger. I know it's counterintuitive to what you were talking about a little bit, but I think it is important that, like you said, you're journaling because everybody's different. And
Yeah.
if you're finding a theme, then I love that you just said to find out what your triggers are and journal them.
Exactly. Because everybody is different, right? You know, it may be that we hear something is a trigger, but it may not be for us, or something else may be a trigger for us.
Yeah, yeah. So
Great
Allison, I
point.
just feel like you should, yeah. If it is if it's consistent, then I would back
Yeah.
off on that.
Yeah. Moving on to some of our other symptoms. So we have mood changes, sleep disturbances, and cognitive decline. So from a mood perspective, I think it's a common myth that mood swings are entirely hormonal and can't be influenced by diet. Not to say that diet is the end all be all for our mood swings. I think there certainly will be some mood swings that occur, which is completely normal, but we can impact it from a dietary perspective. So starting with increasing our magnesium intake. So lower magnesium intake has been associated with a higher risk of depression among menopausal and postmenopausal women. Magnesium is actually crucial for production of our neurotransmitters like serotonin and norepinephrine, which are vital for mood regulation. So being mindful of magnesium intake, making sure you're getting magnesium-rich foods can be helpful. Focusing on complex carbohydrates, especially over simple or refined carbohydrates, as they're more high in fiber, which helps to control our blood sugar. So we're not having some spikes or drops, which can impact mood. It helps with our satiety, which many of us maybe know impacts our mood. It gives us longer lasting energy and helps to promote the production of serotonin as well. And then as also thinking about avoiding excess alcohol and caffeine, two things we noted for hot flashes, but Alcohol impairs our sleep, increases our risk for anxiety and depression, and then caffeine increases our heart rate and our stress hormone cortisol. So it can disrupt our sleep, trigger hot flashes, which can make us feel a little bit more moody. So thinking about mood changes, there are definitely some dietary factors we can impact. Sleep disturbance wise, we want to incorporate nutrients like tryptophan, magnesium, and melatonin. So I want to highlight each of those individually because they kind of each play a step in a process. So tryptophan serves as the starting material for serotonin and melatonin production. Magnesium enhances relaxation, reduces stress, and supports the biochemical pathways that produce melatonin. And then ultimately, melatonin directly regulates the sleep-wake cycle. So it signals your body to fall asleep and stay asleep. So I know I've talked to a lot of people about like taking melatonin for sleep, and it works better when we take it for a little while, right? Repetitively, the same time, we're helping encourage our body produce melatonin at a certain time. That's why sleep hygiene can be so important as well. We want to limit caffeine in larger meals near bedtime. That's really just to make sure that we're not going through digestion while we're trying to go to sleep, and the caffeine aspect keeping us awake as we're trying to fall asleep as well. And then including calcium and vitamin D rich foods. So vitamin D enhances calcium absorption in the intestines, ensuring that the body has sufficient calcium for melatonin synthesis. So it all really boils back down to melatonin synthesis, but also helps with muscle relaxation. So deficiency in either can potentially disrupt the regulation of melatonin. I think a common myth, and I feel like Erin and I were laughing about this when we were putting together the presentation, was that drinking alcohol before bed helps with sleep. I think we've all probably maybe had or heard that thought before. And while sometimes alcohol can initially help with the act of falling asleep, we do find again and again that when we're having alcohol before bed, it dysregulates our sleep cycle and we're having significantly less restful sleep. We're not able to get into the most restful stages of sleep. We often wake up many times throughout the night. So limiting alcohol prior to bed too can be important. Last but not least, we have cognitive decline. So with this, I think it's really focusing on the abundance in our diet, right? Adding omega-3 rich foods, which are things like fish, nuts, seeds. Omega-3s have 3 different components. There's ALA, DHA, and EPA. So you might hear me reference a couple of those. The different omega-3 rich foods have those different types of omega-3s. So DHA is a key structural component of brain cell membranes, which is essential for maintaining their integrity and function. And EPA has anti-inflammatory properties that protect against neuroinflammation, so inflammation in the brain, and that can all contribute to cognitive decline. Omega-3s support the formation and function of synapses, which are crucial for learning and memory. And studies even suggest that diets rich in omega-3s are associated with lower risk of Alzheimer's and types of dementia as well. Outside of that, omega-3s are great for things like cardiovascular health. So I think it's important just to incorporate omega-3s regardless. We're going to add antioxidants. So the brain is highly susceptible to oxidative damage, and antioxidants help to combat that oxidative damage. It's because of the brain's high metabolic activity. It uses a lot of the energy that we're eating in a day. Those antioxidants neutralize free radicals, so they protect your brain cells from damage. That's things like vitamin C, vitamin E, flavonoids, or polyphenols. They help to delay age-related cognitive decline by reducing inflammation and supporting the brain repair process. And last but not least, I have limiting ultra-processed foods. So diets higher in ultra-processed foods can promote more systemic inflammation. So we just talked about neuroinflammation, that brain inflammation. That's associated with neurodegenerative disease, things like Alzheimer's and dementia. It can also disrupt the gut microbiome and reduce the production of our good gut bacteria that also supports brain health, as well as things like many of our ultra-processed foods have a high sugar content, so that can lead to things like insulin resistance, which can also cause cognitive impairment and dementia. And so our common myth is that cognitive decline during menopause is permanent. And if any of those things that I just mentioned can help you to acknowledge is that it's certainly not permanent, right? Maybe we have some inflammation where we're having a little bit of brain fog or a little bit of, memory loss, things of that nature. But we can add omega-3s, add antioxidants, add these healthful foods that are going to help boost our brain health and help negate that cognitive decline that we may see naturally occur. So really wrapping it all up with a bow is when we look at overall nutrition, because I know those were 5 key symptoms, but maybe you're experiencing all of those and thinking, well, oh my goodness, how do I put them all together? I wanted to share this research table that Erin highlighted for me is that really this Mediterranean style diet, so more of a plant forward style diet, it includes a variety of lean proteins, fiber, antioxidants, the different vitamins and minerals like tryptophan and magnesium and vitamin C and vitamin E, as well as just all of these nutrients together really help to support and combat these side effects. So first and foremost, a general thought and tip is really just leaning more Mediterranean style with your diet, which, if you're not familiar, is a diet that's rich in plant foods and then incorporates things like fish and seafood in a little bit larger quantities compared to things like chicken, turkey, dairy, and then our red meats. It's kind of a pyramid with, things like that at the tippy top. Also limiting trigger foods. So I feel like a great discussion about how many of us may have different triggers, right? So acknowledging that maybe caffeine and alcohol are triggers for a lot of people, but maybe you have different triggers. So identifying those. And then adequate hydration. It helps with a lot of our body's systems, particularly thinking about things like hot flashes, our cooling system, thinking about keeping us cool so we're not having mood swings, etc. So really focusing on adequate hydration for overall well-being. And then to highlight some non-nutrition tips, I just wanted to make sure that I tied in that regular exercise is equally important for management. So getting aerobic exercise, strength, balance and flexibility, even pelvic floor exercise, your social support network is so important to managing these symptoms, establishing a sleep hygiene and a routine practice, getting into stress relief and mindfulness, and really focusing on self-care. So things like, exercise, acupuncture, meditation, massage, focusing on what self-care means for you. Maybe it means preparing a healthy meal, right? And incorporating that as part of your routine. They're all equally important when it comes to symptom management. So with that, those are our main symptoms for short term, but let me stop sharing. Let me actually I'll keep sharing, but let me transfer it over to Erin.
Thank you. Yeah, and we've had quite a robust chat. So I did my very best to do as much answering and providing of details as possible, but know that I will cruise through what I have, talking a little bit more about long-term health implications relative to medically induced menopause and menopause in general. And then we'll answer as many questions as we can at the end. So this portion of the presentation is when I say our mindset, we really want to play the long game, right? So we're looking at long-term, how can we support our health when we know that down the line, we are at risk for certain diseases or conditions as a result of estrogen deficiency. So first and foremost, we'll start with bone disease, which probably is not a surprise to most of you, but perhaps this isn't something that has been brought to your attention. So when we're talking about bone disease, we're talking specifically about osteopenia, osteoporosis, and related fracture risk. So as part of a normal bone cycle in healthy individuals with normal estrogen levels, the bone breakdown rebuilding process happens in balance. So it's an ever continuous system where bone will break down by osteoclasts, these cells called osteoclasts. And then at the same time, our body recognizes that, and then we're rebuilding healthy bone. And that happens in unison. However, what we know is estrogen slows down that overall process. And so it starts to become imbalanced. So bone breakdown happens, and that bone building process cannot keep up with it. And so as a result, we're seeing bone density breakdown, a deficiency or a lessening of good, secure bone density. One statistic that I saw that was pretty compelling is that by the time a woman is 80 years old, she's lost about 30% of her peak bone mass. That is pretty significant. And when we look at the quality of bone overall, we're not only looking at the density, but we're looking at the overall quality, including the presence of micro cracks, which could change bone structure, change mass, change the quality of it. That could mean or lead to impaired bone strength and ultimately increase a person's risk for a fracture. So essentially, we've got this imbalance going on, leading to that increased risk. And we know that certain medications can contribute to that. So certainly, we'll start with tamoxifen. So there has been some observation that there is an increased risk of the development of osteopenia or osteoporosis and fracture reported. However, it's significantly less when we compare it to the use of aromatase inhibitors. And so there is a greater risk when a person is using AIs as part of their treatment regimen, specifically postmenopausal women. And now that we're seeing that AIs are showing greater efficacy of reducing risk of recurrence or as part of a long-term breast treatment, some patients are using it for 5 or 10 years. What we're noticing is that this risk is becoming increasingly severe down the line. So again, something we really want to be aware of, playing the long game. So how can we ensure that we're doing the best that we can to support our bone density? And when I talk about with our members these long-term sort of health things that we want to think of over the course of a period of time, we control the controllables. Right? We control what we can do to support our health. You know, not all of us can control what ends up happening down the line with our bone density, but we can control the controllables. And this is where these medical prevention tools can be a really important part of how we play a role in our health. So first and foremost, our regular DEXA scans. So making sure that you're talking to your oncologist about getting baseline bone density imaging, understanding where you are, and regularly following that through to see how that may change. Also taking into consideration genetic history, family history, if you have a family history risk of osteoporosis or osteopenia, if you're entering into this conversation or situation with a level of bone degradation, something worth noting. So making sure that you are staying on top of your regular bone imaging. Weight-bearing exercises. So this is something that I emphasize quite a bit with our community because I think it often goes overlooked. Certainly, you know, when you're connecting with our team, of course, we're going to be talking about calcium and vitamin D, and I'll get to that in just a moment. But what I have learned in reading and connecting with our medical professionals is that weight-bearing exercise is really where it's at. Not only does that contribute to supporting bone density, it helps maintain a person's balance as we get older. It supports overall bone health. And with both of those together, it reduces risk of falls, which can contribute to osteoporotic fractures. And so incorporating weight-bearing exercises. Now you might say, you know, well, how does that work? Like, how can that really make an impact on my bone density? Because here's what happens. When you are flexing your muscles, when you're stressing your muscles out by doing any sort of activity, whether you're doing body weight, whether you're wearing a weighted vest, which I have to applaud our community because that has come up quite a bit recently in some nutrition consults I've had, whether you're using resistance bands, light weights, what have you. When you are stressing your muscles are connected to your tendon is connected to your bone. And so that trickle down stress, that connection to the bone, is where it allows your body to improve that bone density. So just as we heard Aubrey earlier mention other things that we can do, cardiovascular exercise, but also strength work should be a part of that as well. Now, we don't all have to shoot to be or look like Arnold Schwarzenegger by any means. And you don't have to start working out 3 hours a day in the gym in your neighborhood, right? This can be things that are approachable, things that work for you that you can do in the home. Providers like Priscilla at Stronger Through Cancer, she has seated strength, right? So this is something that is adaptable for your lifestyle in a way that works for you. But it is really important that this is a part of the puzzle as we talk about supporting our bone density. We also have bisphosphonates. So this is a class of medications. There's oral NIV. Many of you may be very familiar with them. Fosamax, Actonel, Boniva, Reclass, Zometa. They are different examples of different bisphosphonates that are available to us. They are effective, right? Especially for those that are at higher risk or are already at a state of having some osteopenia or osteoporosis. However, we do know that it comes along with a serious, although uncommon, toxicity side effect that may occur down the line. And that includes osteonecrosis of the jaw, so bone breakdown in the dental area, and an atypical fracture of the femur shaft. So this is where it's really important. And Aubrey, if we can go to the next slide, that you are having a conversation as you decide on how you can best support your bone health as an individual, taking in all of the different factors and having that open conversation with your physician. So I love this chart that we're showing here because I love a diagram, and it just sort of gives you some speaking points and a better understanding of why your physician, your oncologist, may be recommending certain ways. So what you're seeing at the top, patient with breast cancer receiving aromatase inhibitor therapy, and we sort of break it out. So if your T-score, which is a measure from your DEXA scan looking at your bone density, if it is within normal range or not at a 2.0 or greater, no additional risks, then we're just focusing on nutrition, right? And we're doing regular imaging of your bone mineral density. If you have a T-score of 2.0 or greater, that's where we're going to start to enter into this conversation about bisphosphonates and regular monitoring. And then we've got these factors in the middle that if someone has any two of the following risk factors, your age, low BMI, if there's a family history, a personal history, long-term use of oral corticosteroids, which we know affect bone density, long-term smoking, something to consider, again, sort of as you are having those conversations as to what works for you. Okay, so I love this because it kind of gives you a roadmap and a better understanding of your path based on your individual health status. Moving on, jumping back to some long-term implications. So I want to dive a little bit into nutrition, very high level. So calcium and vitamin D, of course, when we talk about nutrition and bone density, these are the two minerals that most commonly come up, understandably so. So in a large review meta-analysis, we did find that supplementation of vitamin D and calcium in older patients has been shown to reduce fracture risk. So supplementing with calcium can be an important and a necessary addition to a person's overall healthy diet, focusing on calcium foods. Now, one of the questions that we often get are, and I saw this in the chat relative to magnesium, right? There's a lot of different forms of calcium out there. How do I know which one I should be taking? So the two most common are calcium carbonate and calcium citrate. Calcium carbonate is 40% elemental calcium, meaning it contains the most amount of elemental calcium per serving. It's also the cheapest. It's most readily available. So it's a good first step for someone that wants to add some calcium. A brand example of calcium carbonate our Tums, okay? However, this is also known to be associated with an increased GI distress, gas and bloating, although because it's higher in elemental calcium, a person has to take less tablets in order to meet their calcium needs. Now, on the other hand, we have calcium citrate, 21% elemental calcium. So per 100, elemental calcium takes up a little less space, which means a person may have to take more. However, it's often preferred over other forms because it's more readily absorbed and it's less likely to cause side effects. So especially for those that may have some reflux issues and you're on a proton pump inhibitor or an H2 blocker, so you have low stomach acid, this is good for you. If you have inflammatory bowel disease or any sort of absorption issues, this form is good for you. A brand example of that is Citracal. So general recommendation for how much calcium a person needs in a day. General recommendation, you're looking at, for those that are 50 years and under, 1,000 milligrams a day, 51 and older, 1,200 milligrams a day. The North American Menopausal Society recommends anywhere from 1,000 to 1,500 milligrams of calcium per day for postmenopausal women. Now, if you did not know, because I always say calcium is the high maintenance mineral. So it likes to be, it's better absorbed in small doses. So that's why your physician may recommend taking it twice a day, breaking it up. You're looking at about 500 milligrams at a time to maximize absorption. And then, as Aubrey said, we want to make sure that we're getting vitamin D because they help each other in the absorption process. They actually activate one another. So vitamin D toxicity is rare unless you're taking super high doses that aren't necessarily needed. Think 10,000 IUs, international units, or greater for a period of time. So generally pretty safe. The recommended daily amount for those that are 70 years and younger is 600 international units per day. You'll see that little IU, 800 milligrams or IUs, I should say, or higher for those that are 70 years and older. Now, I want to circle back again to something that Aubrey said earlier and relate it to bone health, and that is the Mediterranean diet, because studies have shown that for those that follow, that better adhere to the Mediterranean diet, it is positively associated with improved bone mineral density in middle-aged and elderly individuals of postmenopausal stage of life. So this was a random control trial that looked at individuals across 5 European centers, and they found statistical significance in that. So that Mediterranean diet, that focus on high fiber fruits and vegetables, lean proteins, lots of plants, nuts and seeds, can even and has been shown to support overall bone mineral density. Okay, I want to move on because I know we are getting close to time, but we still have plenty more to cover. So very quickly, I also want to talk about heart disease and heart health, because this is that we're playing the long game sort of conversation. So as you can see here, when we're looking at cardiovascular risk factors, there's a lot that could contribute, including breast cancer treatment. So how does this work? When we're talking about long-term implications and heart disease, you can go to the next slide, Aubrey. We're talking about anyone that may have received radiation, especially to the left breast or the axilla. Those that receive certain chemotherapy regimens, so the anthracycline class of medications like adriamycin, or those that are on Herceptin, and those that may be taking aromatase inhibitors. And why? Because estrogen plays such an important role in so many facets of our life. It helps improve the flexibility of our blood vessels. It has a protective effect for overall circulation, and it plays a really important role in lipid metabolism. We've also seen that in menopause, there may be an increase in blood pressure. So sodium sensitivity also increases, leading to potential for fluid retention, also leading to cardiovascular disease risks. So seeing a shift in LDL, rising of an LDL, otherwise known as the bad cholesterol, lowering of HDL, otherwise known as good cholesterol, raising of triglyceride, which is the amount of fat that is circulating in our bloodstream, are things that are known to potentially take place as a result of estrogen deficiency. In fact, some studies have shown that lipid profile changes with a 10 to 15% increase in LDL cholesterol and triglyceride levels happen in the menopausal stage of life. And so it's really important to focus on a heart healthy way of eating. So again, we're going to come back to that Mediterranean way of eating. The American Heart Association recommends a full lifestyle approach when we're thinking about our long-term heart health. So that includes tobacco cessation, physical activity, of course, monitoring your nutrition, which we'll get into, weight maintenance and reduction. Again, we saw that Aubrey reviewed the weight shift that happens as a result of menopause. So I think, again, we control the controllables and really look at the quality of our food choices and really honing in on those food sources that we know support heart health, are higher in omega-3 fatty acids. And we'll talk about some of those individual foods as well. So both the Mediterranean diet and the DASH diet are recommended to follow to help reduce long-term risk of cardiovascular disease. The DASH diet is the dietary approaches to stop hypertension. So for anyone that has high blood pressure or is at risk for high blood pressure, again, both of them are so similar. They're focusing on high fiber, lots of fruits and vegetables, plant forward, lower in sodium, lower in saturated fat, very lean protein food sources. And the reason why both of those are recommended is because they do two things. Number one, they reduce the potential for someone to develop cardiovascular disease. In addition, they can reduce risk for down the line major cardiovascular events from happening, stroke, heart attack. So together, they can really serve a person's health overall. Now, some of the individual nutrients that we want to be aware of. So first are antioxidants in general. So studies have shown a lower incidence of heart disease in those who eat more fruits and vegetables, higher in antioxidants and whole grains. So we know we get antioxidants from the variety of color in our fruits and vegetables and the variety of plants that we make as part of our healthy eating. It's important to note that supplementing with antioxidants does not have the same effect. So we really want to rely on our food sources first and a variety of them. If we pop to the next slide, there's a really interesting nutrient that you'll find in a variety of foods, and they are called plant sterols and stanols. So these nutrients are naturally occurring, and they have been shown to help reduce the risk of cardiovascular disease by lowering blood cholesterol levels. Chemically, they resemble natural cholesterol, and because they resemble it, they inhibit absorption in the small intestine. So naturally, you see this lovely list of all of these plant foods that are very good sources of plant sterols and stanols. I want to make note that dark chocolate is on that list, if anybody, so I'm just throwing it out there. So there is some hope for us. But incorporating this variety is a great way to support your heart health. Now, the American Heart Association recommends 2 grams of plant sterols a day. That is hard to quantify in food. So we really just advocate for a variety of foods and making them a regular part of your diet. You could certainly talk with your physician about taking a supplement if they feel that that is warranted. And that's where you can have a better understanding of that dosing and what would work best for you. Okay, quickly moving to our last slide about this before we just wrap up with a final few. So I want to look at that second bullet there under medical prevention: blood pressure, lipid, and blood glucose control. So we had some questions earlier about that shift in our fat in our adipose tissue storage with menopause. And it is known that that apple shape, that central obesity, is more dangerous for overall heart health. And in menopausal women, the risk of developing central obesity is 5 times higher than before menopause occurs. And that is because estrogen, again, plays a role in where we deposit our fat tissue. So really making sure that we're incorporating things like exercise, weight-bearing exercises to play that role, to do what we can to support a healthy weight. Now, one of the questions that I often get are about blood glucose, right? And like, why are we talking about blood sugar when we're really should be talking about our heart health? How are they connected? They're very closely connected, actually. And it's because in the absence of estrogen, insulin secretion by the pancreas decreases. And insulin, I usually say, is the mailman of our body. So it goes out to the bloodstream, it grabs glucose, and it brings it to the cell to use for energy. If we don't have enough insulin, then that excess glucose is left circulating in our bloodstream, leading to higher blood sugar levels. We also see decreased insulin sensitivity in the muscles, which means we're using less glucose for energy expenditure. There is deteriorating insulin sensitivity by the liver, and all of this creates metabolic changes that can contribute to blood sugars rising over time. And we know that that is a risk factor for heart disease. So making sure that we're incorporating things like complex carbohydrates that are high in fiber to support overall blood sugar is a really important way to support not only our overall heart health, but lower risk of developing diabetes over time. Okay, I know that we are a few minutes over, and I will quickly just touch on if we want to move ahead because we wanted to talk a little bit about cancer under 40 relative to medically induced menopause, because this conversation does create some unique concerns for this population of people. So breast cancer under 40 affects 4 to 5% of those 40 and under. So of all cancer diagnoses, 4 to 5% are those under the age of 40. Certain risk factors contribute to that. Genetic mutations like the BRCA1, BRCA2, certainly a family history, early menstruation, exposure to radiation, overall lifestyle could potentially be risk factors for early diagnosis, although we are seeing this early onset cancer epidemic happening in general. And I know that there's a lot of research going into trying to understand why this is happening. We're also seeing in this cancer under 40 higher rates of more aggressive subtypes. So triple negative breast cancer and HER2 positive subtypes we're seeing in this age group of patient. Unfortunately, it also comes along with a higher recurrence rate and a higher incidence of long-term side effects. So 40% of adolescent and young cancer survivors have 2 or more comorbidities at 10 years out compared to those without cancer. Those comorbidities include high cholesterol, hypertension or high blood pressure, diabetes, and thyroid disorders. It also puts them at higher risk long-term for other chronic conditions like osteonecrosis, breakdown of the bone, osteoporosis as well, requiring joint replacement surgery, stroke, heart failure, subsequent or secondary cancer diagnosis. So there is this whole host of other things that have to be considered in this age population. If we're looking at medically induced menopause unique challenges specifically, certainly everything that Aubrey touched on and I touched on is appropriate for this age group. However, there's a whole other conversation to be considered as well. We're looking at fertility and pregnancy, right? If you're lacking estrogen and you are someone that is looking to start a family or grow a family or preserve your eggs, that poses that unique challenge because there's timing relative to that. Certainly there's financial aspects to that. So that is a challenge very prevalent among this population. Identity and self-image, because the small percentage of cancer patients fall into this age group, it can be really difficult to speak with others about what you're going through or have them understand what you're experiencing and some of the physical changes that happen. You may be experiencing some of these hot flashes and night sweats and weight gain. decades before your friends may experiencing. So being able to grapple with that identity and self-image is really a challenge. Career and finance, right? Cancer financial toxicity is a term that we hear a lot in this community. And so if you're someone that's younger, what is your financial status and stability? Do you have health insurance from your employer? Do you have time off that you can take for treatment, surgery, if you're not feeling well, if you're not getting well rest from your side effects and symptoms? So again, things to think about. Medical literacy and burden, right? In this age group, you may be having to make these long-term decisions, right? Like, what is my long-term plan for supporting my bone density? What medications am I going to be on? What am I going to do to suppress my ovarian function, and how is that going to affect me? So just these big decisions, and understanding the long-term effects post treatment, right? So really, really complex. Relationships and social support. How do you communicate with your friends what you're experiencing? If you are on estrogen suppression, ovarian suppression, and you're dating and you're meeting a partner, but you're not able to have children, how do you share that with someone that you just met? Or when do you have those conversations, right? That's stressful. That's unusual. And these individuals may not have others similar to them that they can sort of bounce ideas off of, right? How did you handle this? Do you have any tips for that? So really unique scenario to be considered. And then finally, mental health, right? In that age group, depending on your friends or your support may not have the maturity to be able to help you through that. We see the mood changes, anxiety, depression that may come along with medically induced menopause. Do you have others around? Do you have access to mental health services? So there's this whole sort of list of things that individuals in this age group may be more inclined to experience. It certainly does not mean that those that are 40 and over are not going to experience that. Please don't misunderstand that, but we feel like it's important to just consider those that may be experiencing this at a younger age have other things to think about as well. So we thought it was just important to bring that on. Now, with that, we've covered a lot. We have gone over our time. Excellent. But I will bring it back to Aubrey because she will take us through wrapping up our speaker series this evening before we hop into some final questions.
Yeah, absolutely. And this can kind of be a collaborative chat moment. But we wanted to bring it back to you and ask, what has worked for you to manage menopause? I know we saw a lot of great suggestions. Like Sue was mentioning, there were a lot of questions in the chat. I think while I was speaking, Erin did a good job of answering many of them. And while Erin was speaking, I did a good job of answering many of them. So pretty much all of the questions from the chat have been answered. So definitely make sure to check out the chat. But I would love for you all to weigh in the chat about what has worked for you. I saw AJ said adding a bit of cinnamon and nutmeg to my coffee in the morning seems to help with the hot flashes, which is great. While you're adding those thoughts into the chat, think about too, if you have any questions, you can certainly pose those in the chat as well, and we will bring them up. But I, of course, wanted to put our contact information here. Please always feel free to reach out to us with questions or concerns, or if you want to set up a consultation. And if I may be so shameless and plug our very thoughtful nutrition hub at uniteforher.org/nutrition. I know Erin linked out to a few things and mentioned, but many of the things we talked about, right? Omega-3s, magnesium, etc., fiber. You can find resources for foods rich in these things on our nutrition hub. We have nutrient guides, we have treatment guides, we have side effect management guides. So please take advantage of those resources. They are available to the public. So I'll stop sharing. And looks like we have, let's see, limited my sugar intake, black seed oil. I see flaxseed in my smoothies. Daily outdoor walks made a huge impact on insomnia. And then just lots of thank yous. So if anybody has any questions, please feel free to unmute, ask. I see Carla, you have your hand raised.
Yes, thank you. How do we feel about bone broth, like beef bone broth, particularly? Like I know talking about limiting meat intake to like lean proteins, but is there anything negative about using beef bone broth for, some of your needs?
Yeah, great question. I can answer this. So I love this question. So usually beef bone broth, if you're making it or if you're buying it, the fat has been usually skimmed off of it if you've ever made it on your own. So the concern, if there is a concern, is not necessarily because we think it's heart healthy from having a lot of saturated fat from the source. If it's something that you're buying, the one concern that could potentially be there is the sodium. So stocks, broths tend to be higher in sodium. So if we're looking at protecting our heart health, watching our blood pressure, sodium is something that we want to be aware of and how much of it is in there. Now, oh my gosh, use your words, Erin. Beef broth can be a great source of collagen, which could be supportive of bone health as well as supportive for nail, hair, skin support. Now, what we usually see is there are mixed reviews as to the benefit of collagen. And a person may typically see that it is helpful to them if it is something that they may be lacking to begin with. So if a variety of protein foods that contain collagen don't take up a big part of their daily intake, then adding something like a beef broth and the collagen that comes along with it may make a difference for sure. But for others that have a varied diet with protein foods that come from a variety of sources, whether plant or animal, and they may be getting those amino acids to build the collagen, they may not see that benefit. So it really varies from person to person.
Okay, thank you.
Yeah, great question.
And Erin, I feel like you essentially answered that question. There was a question in the chat too about taking a daily collagen supplement and if it helps with those. And I kind of answered too, because I know we've done some research on collagen supplements, but I feel like you kind of touched on it as well. Like you said, maybe if there is a deficiency, perhaps, I think it's important to notice that collagen is also a source of protein. So again, that lean protein, equally important. And knowing that things like vitamin C, for example, which is in lots of our produce, is a building block of collagen in our body. So there are other aspects that we can think of when thinking about maintaining it.
And even if you are looking at perhaps trying a collagen supplement or adding that in, you really only need 8 to 9 grams of collagen specifically per day. So that really speaks to when Aubrey talked about our protein needs over the course of the day. That really is a very small piece of a bigger pie. And that's why it's really important to incorporate a variety of protein foods so you're getting all of those amino acids that you need for varying uses.
We have a question in the chat from Jody wondering if supplements should be used carefully with oncologist advice for women who are currently undergoing chemotherapy treatments.
Yeah, absolutely. I mean, I always err on the side of caution, especially during active treatment, to pause supplements that you are taking. Make sure your physician is aware of what you may be taking. There is certainly a place for supplements in some way, shape, or form in varying instances, but that is a conversation to be had with your oncologist. They can safely be a part of a healthy way of eating, but likely something that you want to pause to reduce risk of interaction with the medication that you may be on, because some supplements have been known to have one of two effects on a medication. They can either increase how quickly it is worked out of the body, so the efficacy is decreased, or it prolongs how long it is in the body, which may not be a good thing either. So the half-life of medication is there for a reason. So you want to make sure that you're speaking with your physician first about what you're taking and making sure that you're following that regimen.
Great. And then we had one last question in the chat, at least that I see at present, was just if one has increased cholesterol due to AIs, does focus on heart healthy diet help to reduce cholesterol overall, or is it kind of a lost cause? And I think that goes into that concept of many of those myths that we mentioned with some of the side effects was like, this is inevitable. This is something that we can't fix, right? I think nothing's a lost cause. I love how Erin said control the controllables, right? And so we can make an impact from that healthy diet perspective, right? From making these choices to eat less saturated fat, to focus on exercise and movement, right? Stress management, staying hydrated. We can focus on all of these controllables to help, from our perspective, support our cholesterol as much as we possibly can. So I think definitely not a lost cause. I think definitely just going from that dietary perspective can be helpful for heart health, but many other things.
Absolutely. Yeah. And in those instances, where additional medications like a statin may be appropriate, always worth having that discussion with your physician on what role that can play, and when added medicine may be warranted to reduce overall risk. But absolutely, I don't think there's ever a scenario where someone, it's just forego all of the quality of your nutritional food choices, because despite seeing those numbers perhaps not where we want them to be, it still will make a positive impact on you as a person.
Yep. That's great. And I think that's all the questions I see. Sue, I don't know if you see anything else that we have
No,
missed.
I went through. I didn't see any that you didn't answer. I want to do a quick reminder too. The nutrition guides that you guys have put together, the registered dietitian team has put together. I'll put the link again in the chat just in case you missed them. They're so good because they break down how many grams that you need of each of, whether it's magnesium or protein or calcium. There is a whole list there. You'll see them on the website. And they're great. Take a picture of them, then you'll have them in your phone. And I use them. I love them. It just makes it very easy because sometimes it feels a little complicated to understand how many grams you need. And that's all listed right there on the top. And then just a little bit on circling back to just a reminder on all those that have an active passport or are in the Philadelphia area, or if you have any type of connection that you want to explore to acupuncture. Acupuncture has been working incredibly well with hot flashes, and there's so much science and data behind it. I know it's something that I utilized when I was diagnosed. So just a reminder to explore that if you can in your area. If you have the means to do so, if you're in our Philadelphia area and you have an active passport, you know that we have that available as well. So just another FYI on ways that we can manage some of these, these menopausal symptoms. All right, I think that's it. I got a text from Alex saying that people are buying our shirts.
Yeah, I can't wait for everybody to match us. I'm very excited.
Oh, it's so funny. She's like, "Are you guys wearing your shirts? Because we're getting orders coming through."
I
Thought
love
that was
it.
funny.
Oh, that is
Well,
such
big
a nice...
shout out once again to our sponsors. We are so grateful that we have them. Our presenting sponsors are West, Merck, and Daiichi Sankyo, and support from GSK, Lilly, Immunogen, which is now AbbVie, and Agendia, and Pfizer, and Gilead. So we're very grateful for all that they do for us. And can you show the shirt? I guess that's just, there you go. Eat more plants.
More plants.
Eat more plants, English and Spanish. Eat more plants. There's a link all the way at the top. Maybe you want to put that at the bottom there.
Yeah, I'll find it and send that again.
Yeah. But we are here, 3 times a month for you. And I love this, that we were able to sit down and have this topic. My dietitian team is going to actually be presenting this topic once again at a really wonderful forum in nutrition, and just really good that we have it as a recording as well. So you can go back, and anything that you missed, you can go back and actually hear again. So thank you both. You're remarkable.
Thank you. Thanks everybody for coming today and listening.
Yeah, that was wonderful. Thanks for being here. And again, hopefully if you have any questions or you want to connect with us individually, you always have the nutrition consult with our team, and we're happy to connect with you. So thanks so much for joining and hanging on with us.
I know, very good. Reminder of our Ask the Experts, Thursday, January 30th, 1 p.m. Okay,
Yes.
Alcohol and cancer. And with our chief breast surgeon, Dr. Dela Cruz. She's remarkable as well. I am grateful for all the advisors that we have. And she'll answer all your questions about the relationship between alcohol and cancer. So including the recommendations. You can submit all of your questions to at uniteforher.org/experts. And we will answer them for you. Okay.
Yes.
Anything else, Erin?
No, we're good. This was
we
wonderful.
got
Thanks,
it.
everyone.
All right, everybody have a good night. Thank you. Bye-bye.
Bye.
Everyone.